Good evening, sir, Mr.
Good evening.
Raguraj. I'm Jessica
Hmm.
Subramania from MSU. So we were given a task to conduct an interview for operation management subject to understand the real life organization that applies in term of operation management. So before I ask the question, I would like to let you know that there are 7 categories. Overview of operation management, operation system design, and so on. So under each
Yeah.
category, there are several questions. Can I start with the first question?
Sure, go ahead.
Okay, under overview of operation management, how
Hmm.
can IA International Assistance Center Berhad as a third-party administrator implement specific operation management frameworks that reduce claiming process such as Lean, Six Sigma, and total quality management?
Okay. So basically what we do is, I mean, we don't really use any management frameworks like Lean or Six Sigma, but
Mhm.
TQM, yes, we do because we are already an ISO 9001 and 27001 certified company. And
Uh-huh.
we basically we use standardized processes and documentation to ensure all the claims or every claim is handled consistently and correctly for the first time. So everything is process driven. It's documented. So anybody who comes in, say to the company to work for the company under the claims team will obviously go for training, and there will be documentation and process flows, step by step guides and things like that. So when you have something like this will obviously help reduce the error. Or reduce errors. It eliminates a lot of rework that needs to be done. It speeds up the processing. And by analyzing the data on this denied claims, then our team can then address the root cause rather than just making quick fixes or half past six kind of problem solving or firefighting. And this will then shift from reactive management to proactive management. And this is where then we also then optimize the system, which will then return fewer errors and a faster turnaround time. Yeah,
Okay, so I'll begin with this next question. To what
sure.
extent does IA current operational structure influence its ability to manage and resolve customer complaints and inquiries effectively, such as centralized versus decentralized
Hmm.
or vertical versus flat hierarchy?
Okay, so of course there are many different types of operational structures as what the question clearly has stated. So you've got centralized, decentralized, vertical, and flat, and so on and so forth. Now we basically adopt the flat hierarchy model because this enables faster communication. It empowers our employees, which means to say that when you empower the employee, you give them ownership of the task or ownership of the case, or an ownership of the decision to a certain extent.
Mm-hmm.
And this then in turn is able to resolve the issue quickly, which also then brings an increase to a higher customer centric culture satisfaction.
Mm-hmm.
Most of the times, especially for like urgent cases or VIP members and things like that. So we practice the flat hierarchy, and we feel that it works because, as I mentioned again, just to reiterate, it empowers our employees. So even if the employee is a junior staff, we will always ask the employee, okay, now what do you think should be done, or how would you approach the resolution, or how would you approach the problem, and what is your um, method of resolving the case or resolving the complaint and something of that sort, rather than going to their bosses, going to their team leaders, going to the managers and things like that. So we let them give us some options, and then we see
Mm-hmm.
whether it works, and then we execute. So we use the flat hierarchy operational structure. Yeah.
Understand. Okay.
Mm.
Next is under operation system design. What
Mm.
are the critical inputs and desired outputs that in IA claims processing systems such as claim approvals, payment instructions, or customer notifications?
Yeah. Okay. So, in summary here, I think you would see my response is slightly longer. But to
Mm-hmm.
summarize this particular question or give you an answer, the membership enrollment data that we receive from the insurance companies or the corporate clients and things like that essential inputs and adequate data sets for our claims team to manage the policies accurately. And this will then help us then ensure the correct benefit allocation with no errors. Yeah.
Okay, all right. And next question is, our IA machine learning or robotic process automation currently being used or could be adapted to transform additional operation into digital first processes?
Sure. So I think as with any TPA in Malaysia or in fact in the world, and I would it's safe to say that AI is here to stay, and it's only going to become a very powerful tool, or if it's not already, or in the very near future.
Mm,
So we
yeah.
are actually at the moment we are actually building and enhancing our AI claims management system. This
Mm-hmm.
is something that we have developed in-house with another partner as well. So this basically will automatically be able to, we use the word adjudicate. So adjudicate means process lah, basically, right? Large hospital bills. It will be able to flag any discrepancies between how will I put it, the procedures done versus the admitting diagnosis versus the medication that is being prescribed, maybe even versus the any other additional procedures that maybe another doctor has done, or for example, like most insurance policies here in Malaysia and in fact worldwide as well, it allows the specialist to visit the patient twice a day. So
Mm-hmm.
our AI system here automatically picks up, oh, suddenly third visit happened on that same day by the same doctor, then it will pick up and it will flag. Then we will tell the hospital, hey, hello, why is the doctor added another one? So we are not going to pay for this, please collect it from the patient, that kind of thing. So it will by using this or by depending on AI to a large extent, but of course, human workforce is still there to recheck it again. We expect to reduce our review time by over 90% per case.
Mm-hmm.
Once it's fully developed and once it's a mature system, we should be able to be processing claims so now on an average we process a fine like a discharge case within 1 hour upon us receiving the complete documents. But with AI, we can probably bring it down to even 30 minutes. Yeah.
So I
Yeah.
understand that AI is the future.
Yeah, of course. Definitely it is, whether you like it or not, unfortunately.
Yeah, unfortunately,
Yeah.
it happens to
Yeah.
me. And
Correct.
so moving on to the next category, which is
Sure.
product and service quality. So
Right.
how does IA ensure that consistent quality in service delivery across all departments and any regional branches or partners, especially in claiming process or customer service?
Sure. So I think to re-echo initially, so because we are an ISO certified company, and also we are registered with a lot of ministries, so we ensure consistency and accuracy through our mandatory SOPs, as I mentioned earlier, structured
Mm-hmm.
systems, standardized trainings, strict KPIs, regular, I would say, staff reviews, and also quality assurance audits. So this is across the board for all departments, even for the contact center, the incoming calls, outgoing calls. We do call quality monitoring. They look at case quality of case notes, how they even update the system and things like that. So yeah.
So, all right. And the next question is, how does IA systematically collect, analyze, and act upon customer feedback to design new insurance services or improve TPA solutions, like
Okay.
complaint
So
service or social media monitoring?
yeah. So basically, here in a nutshell, we do conduct our annual customer and vendor surveys. This is in
Mm-hmm.
line with global market practices, and also again, it's part of the 9001 and 27001 ISO requirements on a yearly basis. And of course, we are able to tailor variety of solutions for the Malaysian corporates. Again, with this new potential shift in 2026 under the new National Health Financing Scheme. I'm not too sure whether you're aware of that. So that's going to be a change in how TPAs will be doing business and how insurance companies will be doing business. But because of the surveys that we run, our QAs, and our SOPs and things like that, I think we should be able to I would say uh, be up to par with the industry and what it needs. We don't necessarily design new insurance services because we are a TPA. We sometimes would recommend uh, enhancement of current products that the insurance
Mm-hmm.
companies already have. Yeah, so we do that at times. But of course, the Malaysian insurance companies are not as how I would say, as not are not as brave as the insurance companies like we manage in Indonesia and things like that, where the insurance member can actually go overseas for medical treatment and it's all cashless. You see, for Malaysia,
Mm-hmm.
it's very like taboo because I mean, of course, Malaysia, it's our country is actually quite good in terms of medical
Mm-hmm.
competency and
Services.
technology and things like that. Yeah. So just some examples there. Yeah.
Okay, sure. Moving on to the next category, which is productivity and performance management. So,
Yep.
what are the key productivity metrics tracked within IA claims department, and how are the issues such as employee workload imbalance, claim backlogs, or seasonal demand spikes managed?
Hang on 1 minute. Yeah.
Yep.
Yeah, okay, sorry. So, our office is very simple. So, especially for the claims department, we track daily employee productivity against set ranges. So these ranges can be so like junior staff, we give them a benchmark. Okay, you have to process maybe between 15 to 20 claims per day. A senior claims analyst maybe 20 to 30 claims per day. A very senior claims member, maybe up to 45 claims per day. And some of
Mm-hmm.
them who are very senior, they can actually process that fast because they are very experienced, they know what to look out for and things like that. And if, say, for example, there is like workload imbalance, sometimes you get multiple people who are not well.
Yeah.
The contact center floor has like some viral fever, viral flu, and stuff like that. That is fine because we do have on-call staff and we can always
Mm-hmm.
activate them. And sometimes also, there has been a few times previous years when the case volumes surged, like really, really spiked. It was flowing over, flowing over, flowing over, flowing over. So we also have used financial incentives to handle spikes and backlogs. So we'll tell the team, okay, you've got 10 days to zero rise everything. And if you all can do it, we will put 2,000 ringgit into a pool and whoever worked on it can share equally, that kind of a thing. So it
Mm-hmm.
drives, so financial incentive drives more productivity, but also with the what would I call it, with a very watchful eye to ensure that doesn't mean you're fast. You also must be zero errors. Because
Yeah.
it's something sometimes you just okay, chincha chincha, you get it done, but there's so many errors and stuff that yeah. So we do that as well. Yeah. So basically to summarize it, so we yes, we do track the daily employees' productivity against set ranges. We manage imbalances with on-call staff. Sometimes even some of the HODs also will step in and start processing claims. And at
Mm-hmm.
times we do use financial incentives to handle spikes and backlogs. Yeah.
All right. And moving on to the next question, how do
Mm.
structured employee training programs, medical billing certifications, and career development plans directly influence operational efficiency and customer satisfaction?
Okay, so this for us has been very clear from day one. So we have a very structured training program for new staff that come and on board with us. There are
Mm-hmm.
ongoing training programs that are being done on a yearly basis, so maybe twice a year, sometimes three times a year, internal trainings. Um, Career development, of course, we push. We try to identify really good employees and we send them for these insurance training classes and courses and stuff like that, which sometimes take up to a year. It costs a fair bit, but it's an investment into that particular staff. And when that staff gets that certification, this person, he or she is like one level above, that kind of a thing. Because it's not a very easy certification course to do. So with all this, then we find that it reduces errors. We ensure it ensures compliance. We try to always retain the skilled staff, which of course results in consistency, higher quality service, and greater customer satisfaction as a whole. Yeah.
All right, and moving on to the next category, core operational function. Under this, we have what are the interdependencies and workflows between IA primary functions, claim administration, provider network management, and contact center operation and health program management.
Okay. So this question is basically very easy to answer. So our entire process, it's linked. The end-to-end process is linked from case initiation to the provider network, to claims, to program management, everything into a seamless loop. This is there. Again, everything is process-driven. This will then help ensure the members to get fast authorized care through the right kind of hospitals or clinics or whatnot and things like that, with accurate financial processing and data-driven oversight. Yeah. So it's all linked. All the departments are interlinked and interdependent
Interlinked.
on each other. Yes.
Yeah.
Yes.
All right. Okay, how do the finance and operation departments collaborate to monitor claims, cost containment, provider payments, and TPA profitability while maintaining service quality?
Okay, this is very straightforward. So operations, we look at controlling costs, ensure the claim is accurate, and manage appeals, ensure that there are no errors and so on and so forth. And where else? When it comes to finance, they audit the overall results. Of course, they oversee the money, cash flow, and they track the key metrics of the company. So as a collaboration team, operations and finance, they link the financial and service the data to balance cost savings with quality, profitability, and customer satisfaction.
Okay, all right. Moving on to the next category, which is mission and strategy alignment. How does IA mission to provide high standard service and become Malaysia's preferred TPA shape its operational decisions, process design, and performance metrics?
Okay, so our mission is basically to be Malaysia's preferred TPA, where we drive a strategy, I would say strategy-centered 24/7 support, digital automation, customer-focused processes. All these are managed by KPIs, as I mentioned again, like for example, FCR, first call resolutions, turnaround times, customer and provider satisfaction scores. All this is done to ensure efficiency, and cost control is done, most importantly, without compromising the service excellence.
Okay. The next question, what long-term strategic decisions such as tech investment, expansion into wellness services or regional partnership are necessary to align operation with a mission focus on service excellence and healthcare access?
Okay, so in terms of long-term strategic decisions, of course, right now we're currently focusing on our technology capabilities, with multiple elements of AI and infrastructure being worked on, being vendors that we are appointing to keep up ahead of the game. In terms of expansion into wellness services or regional partnerships, this is an ongoing I would say ongoing exercise that is generally being done by the provider network department, because wellness services, we have certain vendors. Regional partnerships, yes, we have certain companies that we deal with, like in Vietnam, in Philippines, in Indonesia, and things like that. So it's relationship building and relationship maintenance is of course there, whether it's current vendors or new vendors, but core that we are focusing on is ramping up our AI and technology element, because you sleep today, tomorrow you wake up, something is already changed in the technology
Yeah.
world, right? So we are constantly just enhancing. And the good thing about us is because we have our development team sitting in-house in the office, they are constantly also figuring ways to keep enhancing our system. They're doing a lot of change requests that our guys actually ask them to do and things like that. So on a day-to-day basis, development is ongoing. It's just ongoing, building. Yeah.
Yeah, sure.
That's all.
The last part category, which is operation strategy and competitiveness. Under this, we have
Sure.
last four questions.
Sure.
First one is, how can IA leverage a cost leadership strategy through operational efficiency, provider negotiations, and tech automation to remain competitive as a TPA in Malaysia's health insurance ecosystem?
Okay. So IA would want to achieve, yeah, IA would want to achieve cost efficiency through very lean, paperless operations, which we are moving very efficiently towards, supported by data-driven staffing, smarter provider negotiations focused on value-based care, utilization management, tech automation with robotic process automations, artificial intelligence, machine learning to streamline the claims, as I mentioned, and prevent fraud,
Mhm.
which is obviously all this will then be able to deliver sustainable savings without compromising on the quality of services that we are providing to the end user. Yeah.
All right. The next one is, how can IA build a differentiation strategy by offering superior service levels, faster processing, or tailored healthcare concise solutions compared to other TPAs in Malaysian market?
Okay, so in essence, there are three pillars. Our strategy has got three pillars. So number one is speed and service excellence through
Mm-hmm.
automation, which has faster claims submissions, which then equate to faster payouts and 24/7 support. The
Mm-hmm.
second pillar would be personalized concierge solutions with dedicated case support, dedicated people on the ground in the hospitals, tailored wellness programs. And of course, last but not least, the third pillar would be critical strategic data insights using analytics and benchmarking to guide policy design and optimize client value and outcomes. Yeah. So the main three pillars here. So you're talking about speed and service excellence, personalized concierge solutions, and
And
strategic data
healthcare concierge.
insights.
Sure.
Yeah.
The third one is, in what ways can operational flexibility, such as dynamic staffing or modular system or adaptable benefit plans that can enable IA to respond rapidly to sudden changes, such as new government health policies or surge in travel insurance claims?
Okay. So our adaptability rests on three different parts. So of
Mhm.
course, number one, we have a dynamic workforce with cross-trained and contingent staff for surge capacity, as I mentioned, I think in one of your questions earlier. We
Mm-hmm.
have got modular cloud-based systems that we can scale up and integrate extremely fast. We don't have to buy hardware, wait for it to be delivered, and so on and so forth, and things like that. And of course, our flexible, componentized benefit plans that ensure fast compliance, where we're able to model different scenarios and have very unique and strategic client support. So there are three elements to it. Yeah.
Mm-hmm. Okay, and the last question, how can
Hmm.
IA incorporate environmental, social, and governance practices such as digital transformation, green operations, and ethical provider engagement to enhance its long-term competitiveness and reputation?
Okay, so to answer this question, okay, so ESG basically for the E portion, we are driving like a 99% paperless green cloud digital transformation to reduce or to eventually cut the carbon footprint.
Mhm.
The S portion would be to ensure that we engage ethical providers, employee well-being, and health equity for the underdeserved groups wherever possible. And the G portion would be leading in data stewardship with robust governance, transparent cost control, and of course, the most critical now, ethical AI use. That is the most important thing. Yeah. So just the main three parts lah for ESG that we incorporate. Yeah.
And that's all for my questions. And thank you
Sure.
for giving an insightful information regarding international air system. Priorly, I don't have
Sure.
any idea about this, but at least
Okay.
I get to know some information that will be really
Yeah.
helpful for my project. And thank you,
Sure.
sir, Mr. Raghu.
Sure. So I
Alpana,
recommend, so yeah, so sorry, what I recommend you to do is, I mean, for you to understand a little bit more clearer on
hmm?
what we do, who we are as a company and things like that. I mean, just go into the website, Google us and
Yeah,
stuff like that.
yeah.
We are there. That would obviously
Mhm.
help with your submission as well. Yeah. Yeah.
Thank you. Can I have a screenshot for my appendix for my report?
How do you want to do a screenshot?
I will screenshot you. Just look into the
Oh, okay,
screen.
okay. Oh, okay. So I
Look
haven't even
into
had a shower
the
yet, but
camera.
okay, sure, sure.
Okay. Okay, 1, 2, 3. Okay, that's all. Thank you.
Okay.